this up just a little bit higher. Stay nice and still. And you're doing very well.
Up there.
So I think this job is fantastic. I'm really enjoying it. My name's Prashanti. I'm a GP registrar with NTGPE. This is my first rotation as a GP registrar, and I'm doing my extended school placement, which is the paediatrics outreach job. I was really keen to sort of dip my toes into the remote setting. The benefit of this job is that it is still based in Darwin, but I still have these regular trips to various communities where I get to see the type of work that's conducted, the resources that are available, hear some of the inspiring stories, but also learn about some of the challenges and the reality of working out remote. We have to get up relatively early to catch usually an early morning flight out from Darwin Airport, arriving at Gove Airport. Each clinic setup is slightly different. We have a child health nurse and we also have Aboriginal health practitioners as well. The child health nurses are responsible for running the day and they always do a really good job. We are given a list of patients first thing in the morning that are all triaged, and we know which patients are a priority to be seen for the day. Actually seeing the kids on a day-to-day basis and building on my paediatric skills is definitely a challenge. There's a lot to learn with regards to culture and language. That's where the Aboriginal health practitioners and the remote area nurses, or even the GPs that have been in the communities for a long time, are incredibly helpful. They are the ones that can tell us what would be best for each family and what to be aware of within the specific cultural context. It makes me realise that there's a lot of other broader social and cultural issues that we're not privy to necessarily in the hospital tertiary care setting, and it's those broader contexts that we need to take into consideration when we see each patient, because it really forms the way in which they view their health and they view the health conditions that they're facing as well. There's always people to talk to as well if there are any concerns with regards to how the rotations are going, and they regularly suggest that we have training and learning advisor meetings during our rotations across the years to make sure that training and our development as future GPs is going smoothly.
Yeah. Sounds great.
A lot of these communities are set in these absolutely magnificent locations like this. I think coming out to these Indigenous communities, being able to appreciate what these communities are like, all of this gives me a much broader understanding of the context in which our Indigenous patients live in and what issues they bring with them when they come and see us in the clinics. In that sense, it definitely helps to build my skills as a doctor. I really enjoy myself in these clinics. It's amazing the level of interaction and engagement you can have with kids despite not necessarily being able to speak the same language. To be able to come to these communities and for a day to be welcomed into the clinic and the clinic lifestyle, and to have patients accept that we've flown from Darwin, we might not know all about their community, but they're willing to share it with us. It's a real privilege.